Okay, hello everyone. I am Danielle Varda. I'm the CEO and founder at Visible Network Labs, and also an associate professor at the School of Public Affairs at the University of Colorado, Denver. I'm so pleased to have you here today. Today is our webinar on strengthening social connectedness using public policy, an area that we have a lot of interest in, and some fabulous speakers today. So I'm just going to get right into it. We have a couple of folks with us today, and we're going to do some more in-depth intros in just a moment, but we have Pam Coleman, who is currently an executive and management coach, but has had a career in the federal and state government, which you'll hear more about. Dr. Dragana Vidovic, who's a senior research officer at the Connected Communities Project with the University of Essex, and Deneen Saccone, the policy and advocacy lead Coalition to End Social Isolation and Loneliness. So you're going to hear a lot more from each of them in just a moment, but I'm going to do a few housekeeping things just to get us started. I always like to brag a little bit about Visible Network Labs and what we do, but we are a company that has a mission to make invisible networks visible. We know that we're all embedded in some kind of social connections and that they're largely invisible to ourselves and the people who are trying to help us. So if we can make those visible, we believe that we can use that information to make big impacts, social impacts, help people improve their health, mental health, and wellness outcomes. So we are a pretty big team, a social enterprise. We're dedicated to strengthening social connectedness and envision a world where everyone has a social support that they need. We do that through workshops and webinars like this, but our primary product are technology-based data and mapping tools. And specifically, our platform is called Partner, and it's a social network analysis data science platform that people use all over the world to track really hard to measure things like relationships. So how things are connected, and then the quality of those connections and how they impact outcomes. We do that with two products, one, Partner Me, which I'm going to talk about in just a second, and then our CPRM, which communities use to track community networks, kind of over time like you would with a CRM, but we add the layer of the community partnerships. But the work that we're talking about today and that this webinar series has been connected to has been related to Partner Me, which is a little bit more at the individual level and how individuals experience social connectedness, either through adverse things like isolation and loneliness, or adverse social connectedness, like being connected to a lot of others that may not be healthy relationships for us, but also the strengths that people bring to their care and through their social connectedness that help them be healthy. So what we're trying to do is really help providers and helping professionals see that in ways that aren't common, so that they can integrate it into their care. We have partners all over the world and the country, which we're really proud of and like to always kind of mention. Okay, so on to our specifics about the webinars. We have gotten through a lot this year. So here we are in September. We have a couple of more coming up in October, November. You can find all this on our webinar, on our website. Next month's is really about technology and how collaborative technology approaches are helping to strengthen social connectedness. And then the following month, we're going to just do a real focus on Partner Me. So everything I was just talking about, we'll demo it, we'll let you try it, and it'll be just a really fun time to kind of bring that together. And then in December, we're going to try to wrap up the year. Okay, so before we get started, one of my favorite things to do is actually kind of really try to bring the community that's here with us together forward. So what I'd love for you all to do is go to menti.com or scan this QR code and just answer a couple of questions. We just like to, aside from having you in the chat introduce yourselves, we like to have you tell us a little bit more about yourself. So I'm going to go over to the Menti, and I'm hoping someone from my team will put this into the chat for folks to answer these couple of questions. So I'm going to give you a second to get the information. And then I'm going to switch out. And I did a share. Let me share the whole screen. Okay. All right, so great. So what we're looking for here is not just your title, what you do for a living, but also who you are. Like, are you a mother? Are you an aunt? Are you a pet owner? What are your hobbies and things like that? So, sorry, I had it on the wrong screen for a moment. So is this one working? Let me see. Okay, great. Let me go and see. Usually we get it. There we go. Okay. Well, I don't see this one populating. I'm not sure. There we go. All right, so it took a second there to go. But what we do this every single time, and it's been really fascinating to see kind of the type of people that come to the different topics. And so one of the things we're doing is using this just to kind of understand the community of people who care about social connectedness and different ways that we use words and think about it. So excellent. I don't want to spend too much time on these because we have so much good content. I want to make sure that we get to it. So I'm going to go ahead. Awesome. So we have a couple of researchers here and definitely a lot of family members in really great ways, but strategists, community members, network visualizers. Great. So, and a fan, that's so fun. Okay, I'm going to go to the next one. So this one was a little harder. I here just kind of put it out here. What are some words that demonstrate what policy on social connectedness means to you? I thought that's something I'm really curious about. When we said we're going to have a webinar on policy, we were thinking, that's so many different things. So great. So some different words. I think that generally we can see a good sense of things that actually define social connectedness for us. All right. Okay. Well, thanks so much for doing that. I'm going to go ahead and go back. We'll, we got a whole bunch of others popping up. Let's see them for a second. Placemaking, accessibility, SDOH programs. Great. So lots of jargon in here too, which is probably what we're going to face today with policy. We know there's a lot of ways we talk about social connectedness that differ across different sectors and communities. And I think we'll hear a little bit about that. So that'll be nice. Okay, so I'm going to go ahead and go back to, to our presentation. Let me catch ourselves back up. Okay, so thanks for showing who you are a little bit right now. I think that's really important. So I'm going to go and get into our content today. And so we're going to start with Pam Coleman, who has joined us. And I'm going to, so this is what I decided to do with Pam. She's kind of a discussant for us today. And then Deneen and Dragana are going to do presentations. But Pam is someone I've known for some time, but I met very serendipitously through network leadership work. So we were connected through someone who said, like networks happen all the time, you two should know each other. And it's one of my favorite parts of the story is that the first time that I set up a phone conversation with Pam, I think I called her at a number she gave me and she answered the phone. This is Pam Coleman from the White House. And I always say, I don't think that I'll ever have the chance to have a phone answered again by the White House. So it was a really kind of fun moment. She was working for Obama at the time. And you'll see here that now Pam is an executive and management coach. There's a whole story here about how she's sitting here today doing that work. But let me just introduce her by some of her titles, though. Also, she was most recently, within the last few weeks, the Associate Director of Performance and Personnel Management for the Office of Management and Budget, Executive Office of the President. Before that, the Director of the New Mexico State Personnel Office, working for the governor there. And at the White House, Pam has had several different roles, too, as special assistant to the president. The last one I met her as leadership development team lead, but has also worked in energy and environment and the Department of Homeland Security, and has just had a really long career in federal and state government, and is also, I'm going to put this, really fun. This was her LinkedIn description, which I thought was actually the reason why what she's going to talk about today will make so much sense. On her LinkedIn profile, she has irrepressible public servant, network weaver, organizational belonging alchemist, responsible American idealist, joyful warrior, for progressive values, and energetic public speaker. I think you'll find all of those really true. And so when Pam said yes, I asked her, could you come and talk a little bit about why social connectedness should matter to the people working in government and creating policy and implementing policy. So Pam, I'm going to turn it over to you and ask you to share your thoughts and help us frame our conversation today around what it means, how policy and government can be impacted when we add a social connectedness lens to the work. So welcome, Pam.
Thanks, Danielle. Thank you for that introduction. And it's really a pleasure to be here and also to be on with such distinguished panelists. I'm really looking forward to the conversation that you're going to lead in a little bit. So I want to just say that in this moment, what I'm doing is that I am a management and executive coach, but what I am doing is that I left the Biden administration in order to provide pro bono coaching for folks who are working in voter mobilization and on campaigns for voter mobilization. And it's really important. I love government, and I think the only reason we can talk about policy right now is if we have a well-functioning, good government, and that presupposes democracy. So voting to me is like, it's the core foundational franchise that is outlined in the Constitution. And I will note that back in June, the American Medical Association updated their policy to acknowledge that voting is a social determinant of health, and it significantly contributes to all the other social determinants of health as a key metric. So that's what I'm doing right now. I think it's really important to lay that groundwork and to also say that if you have good government, then you can actually get to well-intentioned public policy. But in order to talk about incorporating social determinants of health, or thinking about social determinants of health, or thinking about communities and individual people who are affected, you have to have well-intentioned public policy and well-intentioned, it has to start there. So that's why, from me, making sure that we have good government, I feel really proud of the work that the Biden administration has done thus far. And just a couple examples of thinking about how the social determinants of health have impacted the development of policy and vice versa, and how they are informed by that, is that just in the last week, or not even the last week, but the Environmental Protection Agency just established the Office of Environmental Justice and External Civil Rights that's focused on the needs of minority communities that have been overburdened by pollution. And also that office will oversee the delivery of $3 billion in environmental justice grants created by the recent passage of all the fantastic climate legislation in the Inflation Reduction Act. So that's a clear example of thinking about how can you have good policy developed and thinking about how it gets implemented on the ground. So the thing I'll say also, as you frame this conversation, is that when you think about policy, there's the creation of the policy being importantly informed by social determinants of health. And I don't think that there's many policymakers who don't get it, that you eventually want your downstream effect to touch and impact the real people who are in need, to mitigate human suffering, to make their lives as dignified and productive and thriving as possible. So all of that is, I think, almost as presupposed in certain administrations, but then there has to be implementation on the ground level, and that intersection between the people who are being affected by the policy and the policy implementers, whether that's through the federal government or whether that's through grants down to state or local governments. So that to me is like a big nub about the development of policy, but thinking all the way downstream to how the real person is affected. And in just two examples, and then I'll turn it back to Danielle, but two examples that I saw directly when I was in the Office of Management and Budget is that the very first executive order that President Biden signed on day one, the first one on day one, was on advancing racial equity and support for underserved communities. And that's through the federal government, right? So and that's all the money that we spend. And how do we as the federal government think about equity and think about the disproportionately very bad outcomes that the federal government has either turned an eye away from or was a participant in. And that's really, I think, a key, very important table setter, like day one, to how do we do that better? And the only way you do that, how do you make sure that you're serving underserved communities better, is if you're thinking about like all the way to the end user, but each of the programs of the thousands of programs that the federal government administers. And then the second executive order that the president signed in December of last year was on improving the federal government customer experience and service delivery for the American people. And customer experience is how does the end user how do they integrate into a federal system that is so bifurcated and Byzantine that you as a person, a regular person, if I care about you, says the federal government, but it takes me as the individual, it takes me so many puts and takes and phone calls and bus rides to even get the ability to apply for any of these programs. I am discouraged, or I'm out of I do not have the ability to stay as engaged in the process as for a process that didn't think about me from the beginning. So improving the customer experience of how does the end user, a member of the American public, decide and figure out how to avail themselves of federal services. I think the implementation model of the policy at the end user is also a critical conversation. So there is policy, like there is the policy, and you're going to have a great conversation about that. And then there's the implementation of the policy. And the disconnect, I think, when it does happen, is that it's not about not caring about social determinants of health. It's not about directly engaging with the people who are in need, and then the mechanism by which the information goes from the ground, the people doing in need, and then the policymakers in general. So that's what I would say.
Awesome. Well, and you'll see something about Pam. She's obviously a systems thinker, so can tie all the dots together. So network weaver is a true description of you and what you do so well, Pam. I think that today we'll see a lot of examples of what you said about implementation. I know some of the stories and the examples that our speakers are going to use actually describe some of that on the ground every day. And so thank you for helping us set the stage for this. I know I'm always inspired by your view of things, and it seems like something we're all curious to kind of see the backside of what's really happening, in our big, federal offices that seem so out of reach to us. So thanks for making that more tangible and being so human and real about that and it's really I think lovely to hear people using the term social determinants of health who are sitting in our federal offices and in our state governments, because it's been so long for us, in hoping that it goes from this thing that we all feel and know into policy and into administrations. And so you using that terminology with such ease, I think brings me some comfort that other people are also using that terminology throughout our government. So thank you for your framing today. And okay, so now we're going to go ahead and switch to our speakers. And if you have questions for Pam, go ahead and put them in the chat. I think she'll be back and forth a little bit on screen, or maybe not on screen again. So we can always get questions to her. So we're going to start with our first speaker, Deneen Saccone, who is the policy and advocacy lead for the Coalition to End Social Isolation and Loneliness. So Deneen, I'm going to read your bio so folks know a little bit more about you. Deneen has more than 10 years of experience in healthcare regulatory and policy topics, including provider reimbursement, payment and delivery system reform, and the Affordable Care Act. She also has international health experience related to developing HIV/AIDS provider networks. Deneen joined the Coalition to End Social Isolation and Loneliness after working as the Director of Healthcare Reform Policy at the American Speech Language Hearing Association, where she supported the association's national advocacy strategy pertaining to essential health benefits, alternative payment models, health equity, and non-discrimination in healthcare. Prior to her position at the American Speech Language Hearing Association, Deneen worked as Regulatory Affairs Manager at the American Academy of Neurology, where she oversaw Medicare and Medicaid reimbursement and policy issues impacting the profession of neurology. Such an amazing background. Thank you for joining us. Deneen, I'm going to share your slides. And what I hope as I make the shift is that you'll introduce yourself and maybe just help us know you a little bit more. And maybe you can just tell us a little bit about how you got to being here today, doing this work, and what got you interested in focusing on social isolation, social connectedness.
Yes, absolutely. So I start off by saying good morning, good afternoon, good evening to everyone, depending on where you are. Again, my name is Deneen Ciccone, and I've been in the health policy space, honestly, for about 20 years, but focusing on health policy for the last 10 years or so. And so what got me interested in the issue of social isolation and loneliness and social connection was actually a personal one that I didn't realize at the time because I was going through it myself. I didn't realize as I was going through it that I became a new mom. I had 2 kids in 2 years, and my network completely changed, and it didn't make sense to me until I was in it. My world became 2 little kids in my house, and I didn't understand how that, I didn't have words to put to what I was feeling and how that impacted me until I became aware of the important work that the coalition does. And I was interested in this and personally heartened by the mission of this coalition because it resonated with me that I think sometimes people don't understand that new parents, not just moms, but new parents, they lose their social network as well. And it's just important to try to continue to preserve those and have resources for them as well to continue communicating and not to get lost in this new, very important role of being a parent. So that is what got me interested in this issue. It was a very personal one. And then just having this background in health policy, it just was an easy fit for me. It doesn't feel like work. It just feels like doing the right thing.
Awesome. Thank you so much. I'm going to go ahead and share your slides. I love that you just described it this way. I think what you described, mission-driven work, doesn't often feel like work because we're so connected to it being successful and seeing that outcome. So thanks for saying that. That actually really resonated with me also. I'm going to go ahead and move your slides. You'll just let me know when to advance.
Yep. So I'm going to talk about over the next few minutes or so with you all, kind of what we're doing as a coalition and how we are addressing the issue of social isolation, loneliness, and social connectedness, and what we think are the drivers to help improve and have a more engaged and socially connected society. Next slide, please. So I think everyone here understands that we are facing a global crisis of disconnection. We know that millions of our Americans are socially isolated, lonely, or both, and that negatively impacts quality of life and health outcomes. And this is happening, as I said, across the globe. So just to do some level setting and to give you an idea of how dire we feel this issue is and why we're so dedicated to making efforts to improve policy solutions and recommendations, is that here's the latest evidence that we know. That in a recent updated study from Cigna, 61% of Americans reported being lonely. And that is up from 46% in their 2018 study. And this is all pre-COVID. And if you take a closer look at subpopulations, what we understand from that survey is that Generation Z is reporting to be the loneliest population at 79%, as opposed to 50% for boomers. And we also see that lower income vulnerable populations are significantly more likely to be lonely than their affluent counterparts. In this same study, Cigna also released some post-pandemic information that I wanted to share with you all. Specifically, Americans with mental health challenges are more than twice as likely to be lonely than those with strong mental health, and that 1 in 4 adults are classified as having fair or poor mental health, and among them, 85% are lonely, compared to 42% of adults with excellent or very good health. And lastly, 1 in 3 lonely adults, so we're talking about 33%, are currently diagnosed with or receiving medical treatment for a behavioral or mental health condition such as anxiety, depression, bipolar disorder. And this is more than double the 14% of non-lonely adults that are diagnosed or receiving treatment for such conditions. So what we believe is that the solutions that are needed to have an impact on increasing and improving ways to be more socially engaged and connected as a society are those that are connected, multi-sectoral, and systemic in approach. And I'll talk about those in a little bit. Next slide, please. So what you see here is this term, this slide kind of describes how we define and how we view the issues of social isolation, loneliness, and connection. And so when I talk about this slide, I kind of like to do it using another personal example. And it's one about my uncle, my dad's little brother. So my uncle and his wife are essentially homebound and have been for the last 5 or 6 years. It's just the two of them. And they have very little social interaction with other people, with the exception of maybe my dad coming by once or twice every few months. So when we look at this objectively, they would be considered as socially isolated because they have very few social relationships or social groups, because it's primarily the two of them, because my aunt is homebound. But lonely, what we describe them as lonely, what they say they are lonely, because loneliness, we define it as a subjective, unpleasant or distressing feeling of a lack of connection to other people, along with the desire for more or more satisfying social relationships. So although objectively, I would say my aunt and uncle are socially isolated because it's primarily the two of them, I don't know if they would consider themselves lonely, particularly if they believe that their social connection is one of quality, meaning they believe that their marital status and the dynamic of their relationship is such that they believe that that social connection is sufficient. And when we also talk about social connection, we look at it on a continuum of social connectedness, which is the degree to which one is socially connected, and that varies based on individual, that varies based on the relationship you have with someone. And then belonging is that feeling of being a part of an accepted member or group. So I just wanted to share this slide to level set how the coalition approaches this issue and how we view these terms. Next slide, please. And so what we know is that the impact of social isolation and loneliness can have a negative impact on one's mental health and well-being. What we do know is that on the physical health side, social isolation and loneliness are associated with the 29% and 26% increased risk of mortality, respectively, comparable to that of obesity and cigarette smoking. And many of you on this webinar, you may be familiar with the often cited statistic that says long-term loneliness can be as damaging to one's health as smoking 15 cigarettes a day. And what we also know is that evidence shows that social isolation and loneliness increase the risk of dementia, stroke, and mental health disorders by 50%, 32%, and 26%, respectively. And evidence also shows that limited social connectedness is associated with suicidal ideation, suicidal behavior, and suicide among other adults. And in the young adult space, evidence also shows that a young adult that has between 3 to 4 social connections have about a 74% lower odds of attempting suicide, which is important. That shows the importance of social connection and not being isolated. And then US youth, grades 9 through 12, who felt close to others at school, had a lower prevalence of seriously considering attempted suicide and attempted suicide, compared to youth who did not feel close to others at school. So this slide, I think, does a really good job of just kind of laying out the real impact and consequences, not just to society, but to the individual as well. Next slide, please. And so with all of this background, in 2018, the Coalition to End Social Isolation and Loneliness was founded by our founder, Andrew McPherson. And the purpose of the coalition is really focusing on combating the adverse consequences of social isolation and loneliness and advancing approaches that improve social connectedness for all Americans. So we are committed to engaging diverse stakeholders, increasing public awareness, promoting innovative research, advocating for policy change, and in partnership with our diverse member organizations that I'll show you on the next slide, we engage in a variety of areas, including developing and advocating for federal and state legislative and regulatory policy interventions, disseminating research findings in concert with our sister organization, the Foundation for Social Connection, and leading public awareness events in Washington, D.C. and across the nation. Next slide, please. So really quickly, what I wanted to do on this slide is show you who some of our stakeholders are, the members that make up the Coalition to End Social Isolation and Loneliness. It is a diverse group, as I mentioned on the previous slide. And I think if you take a look at who some of these organizations are, it shows you that when we say multi-sectoral approach, that is very much true. It's not just focused on healthcare, right? It's focused on social determinants of health, like Pam mentioned. We have members such as Lyft, Meals on Wheels, because we understand as a coalition that it's going to take a holistic, integrated, really intentional, concerted effort to really start to have those policies put in place and adopted that help to create a truly more socially connected society. Next slide, please. And so what I wanted to share with you all is that we are actively engaged in hosting events to increase public awareness about the issue of social isolation and loneliness. And so back in June, during Global Loneliness Awareness Week, which was the week of June 13th, we convened an event at the U.S. Capitol with Jenna Bush Hager and the U.S. Surgeon General Vivek Murthy, called Conversations on Belonging, Connection, and Well-Being. And that was a well-received event. It had a diverse representation from many individuals, members of Congress, and staffers that were interested in learning more, some of the approaches that are being implemented by various groups, and how they could be involved if they wanted to continue to help with the advocacy and the policy work being done by the coalition and others that are committed to making real progress in this space. And coming up in a few weeks, October 11th through 13th, the coalition, in concert with the Foundation for Social Connection, we are hosting our annual action forum called End Social Isolation and Loneliness. It's a virtual event. It's a global virtual event. And if anyone is interested in registering or getting information on how to participate, I would be more than happy to share that information with Danielle or Alex at the end of the call, and that could be shared along in the resources that you all receive afterwards if there's any interest. Next slide, please. And so as a coalition, our main focus right now is the systems approach of cross-sector investigation and action across the lifespan framework, or we call the social framework. And it's currently being developed by our sister organization, as I mentioned, the Foundation for Social Connections Scientific Advisory Council. So what this social framework is focused on is systematically identifying, evaluating, and translating the evidence into practice and policy, identifying opportunities and gaps in research and solutions, guiding policy, systems, and environment strategies and funding priorities, and identifying the universe of partnerships and untapped stakeholders. So key components are found on the image here: person-centered, sectors of society, levels of impact, cross-cutting themes, and collaboration. It's important to note that this research moves throughout the lifespan of an individual from various levels, including society, organizations, community, and interpersonal. And this research includes reports on various sectors, including health, education, labor, nutrition, housing, transportation, and leisure. So again, those social determinants of health that Pam mentioned at the start. And this research is helping to inform the coalition's robust policy priorities that I'll show you really quickly on the next slide. So these are the current policy priorities that the coalition is focused on advocating with members of Congress and at the state level for policy interventions. Increasing public awareness. We're recommending the facilitation of an interagency council focused on social connection. We believe that is necessary to facilitate a more coordinated and comprehensive national strategy to address social isolation, loneliness, and social connection, and that the benefits of this council would include preventing duplication of efforts and fostering an environment of skill sharing. Second, enhancing social services and supports by addressing a broader range of social determinants of health related to social connection. And so we're focused on addressing these SDOH needs for populations such as older adults, new moms, individuals with disabilities, even those with hearing loss, veterans, LGBTQ, as well as other historically or currently underrepresented groups. 3, advancing health services and supports by investing in mental health services, directing public health funding to states for youth through education means, and directing public health funding to local communities like CBOs to have funding to do more screenings to detect individuals who may be experiencing social isolation and loneliness, or who may be at risk for social isolation and loneliness. 4, leveraging innovative solutions to foster connection by reducing barriers and improving access to and use of innovative solutions focused on increasing social connections and or mitigating and preventing social isolation and loneliness. So continue innovations in use of telehealth, social media, app-based services, assistive devices, and other consumer-facing technologies we believe hold great potential and can reduce the negative health effects of social isolation and loneliness. And 5, advancing research and developing the evidence base. So what we do know is that there is a large amount of research right now surrounding the positive health effects of social connection, as well as the negative health effects. However, there's not consistent prevalent statistics nor items included and standard nationwide survey assessments. So to get a better understanding of the prevalence and scope of social isolation and loneliness on the population, particularly after the COVID-19 pandemic, once it is officially ending, items related to social connection, isolation, and loneliness should be included in national public health surveys. Next slide. And so this slide just provides, if you want to get a little bit more information about some of the work we do, the resources and the references that I mentioned earlier in my presentation, you can refer to the information you have here on the slide. If you also want more information about the coalition and the work we do, I'll be more than happy to drop my email address in the chat, and you could reach out to me there as well. Thank you.
Great. Thank you so much, Deneen. I am so inspired by your work. Honestly, since the first time that we met you and learned about your work, I think that we're all really hopeful in terms of what you're doing and the impact that you all are making. And so I can't wait to see how you continue to grow your framework and implement these, and very excited about joining at your action forum coming up. So thank you. I'm going to switch over to our next presenter, and Jurgana, I'll let you share your slide. So I'm going to read your bio first, and I'll let you, there we go. Let me read a little bit about, let you all know a little bit about Jurgana. Dr. Jurgana Vidovic is a senior research officer with the Connected Communities Project at the University of Essex. Jurgana works at the university on evaluating the impact of inter-reg funded social prescribing projects, Connected Communities, implemented in England, UK, and Normandy, France. Jurgana studies social connectedness and loneliness and the impact of these issues on individual and community well-being, civic and political engagement and conflict. She has a background in psychology, political science, and theater, and prior to completing her PhD studies in politics at the University of Essex, studied and worked in the field of social neuroscience, something common between our two presenters, at the Minnesota Center for Twin and Family research. She's passionate about applying academic research to inform and improve decision-making in the field and at the policy level. So Dragana, just as you're getting started, and I do want to acknowledge Professor Gina Reinhardt, who is not here joining us today, but is Dragana's partner in this work. And we miss not having her here today for sure. Dragana, I'm wondering if you can just, before you get started, just tell us a little bit about how you ended up in this work and focused on this topic.
Well, thank you very much, Danielle, for that lovely introduction and for inviting me to the seminar. It's very interesting, and I love hearing about Doreen's work because it's very much linked to what I will be talking about as well. So I lived through the 1990s conflict in former Yugoslavia, and I've experienced all of these emotions, isolation and loneliness and disconnection from the world and the communities that we live in. And it kind of stayed with me as I was studying psychology in my mind. And even now, 27 years after the conflict is over, every time I apply for a visa or try to go out to the country somewhere, I feel still that our society is socially isolated and disconnected, because before the war, we were able to go anywhere and travel freely, visit countries and places, and now we have to go through this horrendous visa application process and fear if we will ever get the paperwork to come and present at a conference or just go for a visit. And so it kind of always stayed with me. And so as I was studying social neuroscience, I learned a little bit about loneliness, but then I moved to study political science and kind of pushed it back. And then when I had the opportunity to link both of the fields, then when the project came along and Professor Reinhardt had the position to work on this project, I thought, well, great, this would be a great way to connect exactly what Pam was talking about, how health impacts civic engagement, and how civic engagement and the way we interact with each other reflects on society that we create, in particular democratic governance. And so, in short, that is how I'm here.
Wonderful, thank you. We love asking people these questions because we always want to acknowledge the visible us side of it. It's the people behind these projects. And so thank you for sharing your story. And I will turn it over to you now for your presentation.
Excellent. So I will start with describing briefly, giving background to social prescribing, the topic that I will be focusing on, and some of the what it is actually, and then some of the challenges in this of social prescribing. So in the UK, placing communities at the heart of public health has been quite a prominent topic of discussion for a number of years. Communities play an important, or can play an important role in reducing health inequalities, empowering people to have a greater say in their lives in health, engage more individuals, all which can then help for communities to be more connected and resilient. One of the prominent leaders in the field of public health, Professor Sir Michael Marmot, has been widely recognized for his work in this area, has been instrumental in driving much of the public health agenda in the UK and research and policy approaches. So he likes to start his talk with this quote, what is the point of treating people and then sending them back to the conditions that made them sick in the first place? Which is quite well summarizes what social determinants of health are. So in his 2010 review, Fair Society, Healthy Lives, better known as Marmot Review, he set 5 policy objectives to tackle health inequalities, and one of which is creating and developing healthy and sustainable places and communities. And he specifies the role that social prescribing can play in that. He's very much active in promoting social prescribing in government work and policies, as well as on Twitter, if you want to follow his work. And here he's promoting one of the projects, social prescribing projects, that has helped turn the health of an entire town to better. So there were a number of other organizations in the UK who have worked very hard and long in promoting issues of loneliness and social isolation, and disconnection in communities to try to address them. And these are just some of them that I can mention for the brevity of time, starting with Campaign to End Loneliness, Mental Health Foundation, Social Prescribing Network, Age UK, Joe Cox Foundation, Co-op, British Red Cross, very worth looking into. They have a number of resources. So let's see, I'll just put all of this. So also a lot of research in this field has shown that social health issues such as loneliness and significantly negatively impact health. And these are contributing to an increase in health and social care service usage, which puts very much additional pressure on health services that are already overburdened by the demand. So all of these efforts combined have led to a creation of world's first strategy on tackling loneliness in the UK in 2018. The goal of the strategy is to first reduce stigma around loneliness, and then ensure that loneliness is considered in policy making and program delivery, and finally to improve evidence base on what works to address loneliness. And again, social prescribing is central element in part of in the strategy to tackle loneliness. Soon after this, National Health Service have published their long-term plan, a policy setting social prescribing to be at the center of personalized care. So personalized care is based on working to understand what matters to people, identifying their strengths and needs and expectations, and trying to address that through social prescribing. So the NHS has committed that by 2024, 2.5 million people will have access to this personalized care, 900,000 which will be referred to social prescribing, and there will be 1,000 new social prescribing professionals who will be hired to deliver this program. So what is social prescribing then? So it's a model that enables doctors, nurses, social care professionals, local agencies, and organizations to refer people to a range of local non-clinical services. People can also self-refer themselves. And professionals who deliver social prescribing are called social prescribers, link workers, connectors. They spend time with people and give them time and attention to understand what matters to them. They develop trusting relationships. They know a lot about the community, and they can then, by getting to know a person better, be able to recommend people to a variety of activities and that could help them improve their health. And social prescribing is seen as a way to address and improve numerous health outcomes, well-being, reducing loneliness, improving social connectedness, and other aspects of mental and physical health. So we just have where the people are referred to, as I said, to a variety of activities, art, cooking classes, exercise, being in nature, volunteering, and things like that. So following that referral, then social prescribers would meet with people to try to understand or try to track some of their improvements and activities as they're engaging more and more in their community. And so Connected Communities, the project that I'm working on, is a social prescribing initiative. It's being implemented by 4 local authorities in the UK and France. And the goal is to reach socially isolated and lonely individuals. And the project will be ending soon in April 2023. At the University of Essex, we are in charge of evaluation, dissemination, and integration. And in the top corner, you can see some of our social prescribers going into rural areas in County Suffolk and visiting people who are socially isolated and promoting services. And so people can receive a service here in the van if they would like. And so it's a mobile kind of service. A big proponent of social prescribing is King Charles, seen here with Camilla Queen Consort in Kent, one of the localities where our social prescribing is being implemented. One of the local charities have received the award, and so they were visiting. But he has actually a couple of years ago given a talk at a international social prescribing conference. So he's a very much big proponent and believer in social prescribing, which is great. There's lots of buzz and interest in social prescribing in the UK. It's been debated in the Parliament recently. Here is Tracy Crouch, First Minister of Loneliness in the UK, talking about it. Again, for the brevity of time, I'll just skip what was discussed. But again, just to illustrate, it's very, very important and relevant topic here. There's a National Academy for Social Prescribing that helps promote events, promote what social prescribing is about, synthesizes some of the evidence that's coming out. And for instance, there's an event coming up soon asking, is social prescribing the future of healthcare? I think they should add social care as well. So very much active field. Global Social Prescribing Alliance, another body that's interesting in this field, is consists of a group of researchers from across the globe, and we can see social prescribing is being implemented in lots of places, not just the UK. So with all of this interest, we thought, well, are there some outcomes and lessons learned that we can share from the UK, and particularly from our own project as well, to help understand it better? So in terms of challenges, so social prescribing has been implemented in the UK for a while, long before the loneliness strategy and the 2019 long-term NHS plan policy. So, but however, this policy has led to a huge increase in the number of social prescribing programs being implemented. As I mentioned, there are about 1,000 social prescribers, professionals being hired to deliver this service. So it's quite increased in numbers. And with that, one of the first challenges and critiques is it possible? It is possible that social prescribing is not eliminating underlying needs, but rather shifting demand from health services to the voluntary and community sector organizations without proportional shift in resource. And we hear these critiques as we go to conferences and as we talk to other people, especially those in voluntary and community sector. And the structures to capture implementation various programs were still in the development when many of the programs are being rolled out. So it's going to take some effort to understand if there was a proportional shift in resources and if the needs are being addressed effectively. Another challenge is, and this is something again that was mentioned in the previous presentation, is that this type of model, holistic approach to health, requires cross-sectoral approach. However, the structures to track this type of engagement were underdeveloped. So we have a social prescriber refers a person to a service. It could be any of the community services, but we also have GP involved, and we potentially could have a social care person involved, or any other statutory services. And so we don't know how they communicate with each other and how are they working, in which way are they working together to see what aspects of social prescribing are helping or not helping individual, and how do we then evaluate the impact of the overall program on one's health. We really have lack of information here. We think it should be, all of this information should be done and recorded centrally via a social prescriber, but there is no structure to do that. So there's quite a lot of things to do there. And there's also lack of standardization. There are various approaches to social prescribing, diverse target populations, different provisions available across communities. So the question then is, well, what is adequate provision? What level of support is sufficient? What evidence of impact can we gather from this? Is it possible to draw conclusions given the differences in population, referral pathways, and outcomes? And lastly, another challenge or final challenge that we thought of was evaluation. There is some level of resistance among providers and participants, given the type and the amount of data that's needed to be recorded. So let's say if a social prescriber has an hour to sit with a person to talk about their health needs and try to understand what would work, what kind of resource would help this person to refer them to. Taking down or recording information by asking questions and filling out surveys would take away that pressure, valuable time from people, and so there's some resistance to this. There's a lack of robust systematic evidence regarding effectiveness or unintended consequences. So it is difficult at this point in time to understand effects of whether to continue or recommend this approach. And I say this time because in probably in a couple of years, we'll have much more information, as again, this has been rolled out in the last several years, and the data and projects will be completing soon, and so we might have more information. And lastly, even though social prescribing is seen as a way to strengthen social connectedness, we see a very small number of studies examining the impact of social prescribing on social connectedness. And again, it varies in terms of conceptual and methodological approaches, so not enough of robust evidence. So that's why we established a social connectedness working group at the University of Essex, where we are trying to identify and examine the gaps in the current research and practice, and collaborate on best practices to advance our understanding of social connectedness, and what actions we can take at research and policy levels to facilitate the work in the field. And so we were really excited to connect with the Visible Network Labs to hear about their measure of social connectedness and how they're approaching this field. And they presented at our workshop, so that was quite wonderful to hear about their work as well. So that's it from us. Hopefully there is enough time for discussion. Thank you.
Yeah, thank you. And I know we are getting at time. Let me, if someone has to drop off, that's okay. We record this and we send it out to actually all the people who registered, which was a lengthy list today. So I think we'll have a lot of outreach around the topics that you've had. Does anyone have a question right now? So it looks like Corey Walsh, you have a lot of really great comments. Thank you for offering all of those, and we'll make sure that our speakers see them also and capture that. So let me know if there's any other questions. I do want to make sure that we can ask at least one of you all. For people who are working on policy in their communities, in their countries, in their area, what would you recommend what would each of you recommend are like essential factors that we should attend to? What should we prioritize if we want to see policy move forward around this topic, if we want to be advocates for this? You know, what's the condition that you would say we need to really start with and make sure is present in order to take that next step? I know that's kind of a big question, but what would your advice be for those of us wanting to move forward in this work?
I can start. So I guess for me, I would say, based on my 15 plus years of experience in policy work and advocacy, step one, an important trait is to have patience. Perseverance, number 2, 3, endurance. And what that means when working in this issue, I think it's still really important to continue to educate the public and raise awareness. Unfortunately, the pandemic kind of did that. And there I am beginning to see a lot more news coverage and more understanding of what it is. I think continuing to identify those allies in your local community, not just at the state level, but in your local community, who are interested in this issue and really working together, strategizing and aligning is important, and coming together on a cohesive message. And advocating could look like so many things. Advocating with your, if you're US based, with the state, members of Congress, finding your members of Congress, just advocating. And sometimes you may feel like your goals are aspirational, and that's okay. But if you have an aspirational plan, aspirational goal, sometimes breaking that down into little bite-sized nuggets can be easier and more digestible for individuals. So really quickly, in a nutshell, that's kind of how I would approach the whole thing. Patience, perseverance, endurance, find your allies, strategize, come up with your big, hairy, audacious bag, right? And break it down into incremental steps that can be moved forward.
Wonderful. Well, I feel that's kind of some life advice too. In
Yes.
general, thank you. Dragana, what would you say? Next steps?
Absolutely agree with everything Danine has said. And I would just add that it's very important to also really work out or record what works and what doesn't work, and report that as honestly as possible, to try to learn from each of these steps as we go along, because some of these things have been around for a while, but some are new. And so evidence is very, very important to start collecting it systematically.
All right. Well, I'm going to go ahead and end us because we've gotten to the top of the hour. Thank you so much for sharing your program work, Deneen, and the work of the coalition. I think it's very exciting and such a needed thing. You shared with us briefs. I'm sure they're not called briefs, but in different topic areas, education, health, that you all are working on.
Yes.
And I would encourage everyone to get to the website and see those. They're just really important, I think, to share. And Dragana, I remember the first time that we met you on one of these webinars, and they said to us, in the UK, they mandated, legislated social prescribing. And we were like, what? Across the country? Like, amazing. Like, just nothing like that, I think, at that scale here yet. And so in the area of social care, in the area of social isolation and determinants. So thank you for sharing that example, especially the challenges that you all face and the questions people are asking. Because I think that in order to make policy something we can implement, we have to face the really hard questions too. But we have a lot of people who really, really need this work right now, kind of more than ever. So thank you for the work that you do. Thank you, Pam, if you're still on the phone. And it's just such an honor to have an hour with you to get to hear about this really meaningful stuff that isn't actually work for you. So thank you so much. And thank you everyone for joining. We'll share this more widely, and I appreciate everyone's time.
Thank you.